I'm Steve Beatty, and I was born in Memphis, Tennessee. I was raised in Africa. My parents were missionaries in a place called Rhodesia, now Zimbabwe. I went to undergraduate school at Vanderbilt University and did medical training at the University of Tennessee in Memphis, Tennessee. I did my residency at the University of Tennessee in ophthalmology. I'm a general ophthalmologist practicing comprehensive ophthalmology. I came to Columbus in 1987 and joined Dr. Gerald and Dr. Calhoun, and we formed a group of three of us, and I was in practice here until 2000. Then we felt the call of the Lord to do medical missions in Africa. I came back to Columbus in 2004 from our medical mission endeavors, and I'm now practicing with this great group of doctors here. When I enter a room to see a patient, my most important thing I want to do is to allow them to know that I care about them, and I want them to see that I'm transparent and they can ask me anything they wish. Patient to me is the most important person in that room is that patient. And I really want to concentrate on relationships and building friendships with the people I take care of. I was attracted to ophthalmology. In fact, I was actually interested in orthopedic surgery first, but I had two very close friends who were mentors of mine who encouraged me in the field of ophthalmology, and so I decided to take a chance and start a residency with that, and it's been a wonderful journey ever since, and it's been a great field that I've just enjoyed immensely in my life. The thing I love most about my field of ophthalmology is the joy of seeing a person who cannot see, and we do an operation or some sort of treatment and their eyesight is restored. It's a great honor just to take a person who's blind or almost blind and bring their eyesight back. I've seen people who have been blind in Africa and Columbus, Georgia, and other places that I've worked at, and the joy that I see when a person, after having had an operation, in Africa they're singing and they're dancing and they're praising God, and it's just a neat, wonderful experience to have that rewarding calling to help people's eyesight. I can think of several instances when I had patients who had issues or events that really have stuck in my mind in my practice career. I can think of one lady who I did an operation on quite a number of years ago, and a week later her vision was 20/20 uncorrected. So I thought I was so good and a great doctor, and I walked into the room. I said, "Mrs. Jones, how's your eyesight?" She says, "I'm very angry with you." I said, "You're angry?" I looked at the chart. Her vision's 20/20, I have an angry patient. So I said, "What is the problem?" She said, "Well, you finished the operation. I went home, and when I walked in the house, I saw all the cobwebs in my house and dirt and dust. And then I went to my closet, opened the closet doors, and all my clothes were mismatched. Then I walked into the bathroom, and I saw this little old lady with wrinkles looking at me in the face, and I was unhappy. So can you change my eyes back to where they were?" I was in Africa last year doing some medical missions, and I saw a little girl who was 4 years old, and her mother had brought her to see me at the recommendation of some people they found out about me, and she had crossed eyes. She was 4 years old. When I was lazy, it was crossed. She had no hope to have this fixed. She'd been told that nothing could be done about this problem. And so I examined her and found that we could treat her. I actually treated her lazy eye first, and then a few weeks later we did an operation and straightened her eyes. And it was the first time an African woman has hugged me, a white man, after an operation like that on her own child, which is a very rare thing because they were very, very closed in their affection for others. And she told the whole village. In fact, we went back this year and did an eye camp at her village.